Kat, there's been some, I don't know how many patients that use olaparib. Obviously it's not a large percentage of patients, but there's a number of trials too coming in where sort of more phase 1, phase 2 range right now, where they're combining that with other drugs like a Pluvicto type of a drug. Are those, and really it's sort of the transition to kind of the future and how you see maybe where things are going and the excitement. And this is really for all three of you, but we'll start with you, Kat.
Yeah, I think, for the PARP inhibitors right now, guideline concordant, they're kind of like late in the, sort of a later treatment in the castrate-resistant setting. But for me, what that really tells me is, with the availability, with the data on PARP inhibitors, with all these things coming in the pipeline, is that you've got to be thinking about it from the get-go, which again speaks to germline mutations being checked when a patient comes to you. It used to be that we were doing it in the metastatic castrate resistant patients, but now every new patients that I see, de novo patients I see, they get a germline mutation. And again, just also looking beyond BRCA mutation, right? Like your PALB2, the HRR genes, which even to a smaller degree than the BRCA mutations, they do respond to the PARP inhibitors. And then again, if you have a de novo patients, checking the BRCA mutations on the tissue as a genomic profile, because those typically are present from the get-go. Those are not acquired mutations. So.
And do you biopsy Mets? Just you kind of brought that up. Do you? And as we know from some of the more kind of basic science studies, that these are, some of these Mets are very different mutations than the original biopsies.
So when I see a patient with progression, liquid biopsy, most often I would do that mainly because, if it is a bone progression, there's always a limitation to tissue profiling on bone specimen. But if there is an accessible visceral metastasis on progression, then yes, I would biopsy with the intent for tissue profile.
And I'll just say, we have, of course, a trial with actinium, as sort of a future trial looking at in post-Pluvicto phase, and we have a handful of patients on that trial now. So there are definitely a lot of exciting things coming out in the future, but I guess we'll end, both Scott and Jose, talking about how you view the future, of prostate cancer in the metastatic state.
My guess is that things like Pluvicto will continue moving up in the treatment ladder. PSA only relapse, I think, is kind of an interesting setting to think about Pluvicto and some of those things. PARP inhibitors, have a place, but I don't think they're going to be widely used.
Immunotherapy hasn't so far panned.
Yeah, immunotherapy has been a little disappointing, except in very select patients, sort of MSI high kind of thing. They were really excited about it at the beginning, but it hasn't been as useful as we'd like it to be. So right now, I think that a lot of it is going to be just moving the current things up in the treatment ladder, is my guess, and just figuring out how to sequence them.
Jose, we'll let you have the last word on trials and the future of metastatic prostate cancer.
Well, as I tell my patients, like you don't become an oncologist by being a pessimist. I'm an eternal optimist. And I think the future is bright for prostate cancer in particular. I think with innovations that we're seeing now, the targeted approach with lutetium, we're finding targets. We're using chemotherapy conjugate antibodies that we have trials for in the pipeline. The actinium, everything's targeted. And when you think about the prostate, you don't really need the prostate to live. So if you can target it, eradicate all the prostate tissue in the body, then you've essentially cured it, right? And so I think with the advent of the trials that are in the pipeline with AI, I think over the next 5 to 10 years, we're going to see things dramatically shift. And again, that might be the principal investigator of me speaking, or it might be the eternal optimist speaking, but I'm very hopeful that over the next 5 to 10 years, we're going to see a lot of changes.